I want to welcome you to the California Endowment. This is your home. This is everybody's home here in California to really convene and promote conversation. I also want to acknowledge a couple of people that were really instrumental in getting all the pieces together. First of all, I would appreciate it if members of the Public Health Alumni Association, if they can please stand up and be recognized for their important work in helping to steward not only this event, but really engage others in public health. Come on, I know there's more of you out there. So thank you for your service and leadership. And then Manasa and Stephen from the School of Public Health, I think should stand up and also be acknowledged because without their support, we wouldn't have been able to pull this all together. So I want to thank you as well. You know, it's always hard to make sort of a few remarks about Ruth Roemer. Just because of the enormity of the topics and issues and how she lived her life. We're just so larger in life. But just to kind of remind us why we are here, why the School of Public Health and why the Alumni Association in particular focuses on Ruth Roemer is because of all of the groundbreaking legal issues that she dealt with in terms of mental health, alcohol, substance abuse. Again, issues and topics that today may not seem groundbreaking, but were definitely groundbreaking over a number of years. And in particular, with her 40 years of commitment to social justice and equity, now we see this tide finally coming around in many public health schools, as well as in other institutions around the social determinants of health and equity, which I think in the past was sort of like something out there that public health would do, but now it's become more acceptable and incorporated in the language. And when you have the Federal Reserve talking about social determinants of health and you have others, you see that influence that she had in sort of really trailblazing this area is having an impact not only in public health, but also a multitude of other sectors. So this series is really in honor of her bravery to stand up to power, her bravery to speak out for those that probably didn't have voice or weren't able to have that space to talk. So I want to welcome Beth to come up and say a few words before we move on to the purpose of this conversation. And we're really pleased that she made the trip from Northern California to be with us today.
Thank you. Thank you. It's always a pleasure to be in Southern California in the sunshine. It's mostly, even more so, a pleasure to be here and get to see the friends and disciples of my parents, of my mother. And most of you may know something about her professional accomplishments that Beatrice just referred to. But I want to tell you about something that's a little more personal. And in keeping with today's program, my mother was a great storyteller. But the way that she told stories was in the interests of her other career, which we in the family called President of Arrangements Incorporated. She tried to anoint me as a vice president, but I've never quite lived up to the task. My mother was enormously good, before the term networking was invented, at putting people together and solving problems. Today, just in the conversations in the hall, someone came up to me and told me how she helped them get a job. Someone else, career advice, not to go to law school under any circumstances. And no one has come up to tell me about it today, but often people will come and say, oh, I met my husband because of your mother. So she had no hesitation in telling people what to do. and no hesitation in helping them solve their life problems. And so that's the great pleasure for me today, is to see the disciples of Arrangements Incorporated here today.
Thank you so much for that, because that just brings, sort of the importance of the heart of social justice work is that we all can visualize and relate to real people in our society and in other parts of the world that are really struggling. And keeping that heart and mind, and then social action is sort of that triad of combination that I think Ruth embodies. So it really is such a pleasure. It's one of the highlights, I think, of the year to sort of remember, harmonize, and the purpose of why we come here today. And so a little bit about the forum today. And it's a nice segue in terms of changing the narrative. So we've been having multiple conversations in terms of the work group about, how important it is to communicate in a different way about the impact of public health and social determinants of health and the issues that are affecting many low-income communities, not only across California, but across the country. And so we felt like, gosh, it was really important to see how we talk about not only data and information and those key tools that we have as public health, but how do we really begin incorporating greater understanding and appreciation of storytelling, and also considering the impact of what stories we're promoting, how we're using data to tell those stories that may have an unintended impact, which can further victimize communities, and other ways of using data and information to really show an empowerment and resiliency and importance of including low-income communities in the conversation. And so there's a straddle there and a tension, I think, in public health of how do you do that work without, promoting or recycling stereotypes. And now that we're in an environment, especially after Ferguson, after many things that have happened across the country, it's really important for us as those that really carry the torch, in a sense, if I'm so bold to say, to really think about population health. How do we think about our messaging? How do we think about equity and inclusion and health equity in what we do and how we do it? So we felt that this panel today, which we're all incredibly excited about, would really sort of begin to lift up that conversation with us from multi-perspectives. And so we hope that today you're engaged, you think of questions, you jot them down, because there will be a moment for Q&A, so that we're having a more engaging conversation. So I want to thank, and I know we'll have someone else come up and do the introductions of our panel, but I just want to highlight and thank them for taking time out of their very busy day to be with us today. So thank you very much for that. So now I would like to call up Dr. Davida Cody. Her credentials, and she will be introducing our illustrious Sarah Shannon that will receive the Ruth Roemer Justice Award. So if you can please come up here and join me. So Dr. Cody received her MD from Columbia University, an MPH at Harvard University. She taught epidemiology at UCLA, medical and public health schools from 1971 to 1985, where she became a friend and a major admirer of the Roemers. A founding member of the Venice Family Clinic, Dr. Cody's 30-year career in international health spanned work with the Peace Corps, the World Health Organization, and a multitude of health justice organizations in the United States and Central America. Dr. Cody is founder and medical director of Options Recovery Services in Berkeley, which offers community-based alcohol and drug treatment to homeless, incarcerated, and other vulnerable populations. So I would love to introduce her to take it from here. And one last message, if any of you need a folder or binder, we have one up here for you if you need to come up. Thank you.
Thank you. Thank you. I want to start with a quote from Ruth Roemer. Individuals who are highly specialized may disregard broader issues in public health, We have the best technical people in the field. They may have no time to investigate broader issues such as universal health care coverage, strengthening mental health services, preservation of environmental controls, tobacco control, and other issues of peace and justice. Ruth Roemer saw the broader issues, and she spent her life addressing those issues. She pushed the boundaries of the public health to embrace the study of socioeconomic determinations of health. Her particular issues were universal health care, reproductive health services, primary health care, mental health care, tobacco control, protection of the environment, but she was interested in anything that affected health, particularly the poor. She was a heavy-duty academic, but she never lost her intimate connection with the grassroots. Ruth was a lawyer and gave me a whole new respect for lawyers. I came to wonder if I could have done more for the health of the world's poor by being a lawyer than a doctor. But now I know that she would have advised me against that. Arriving at UCLA as a young faculty member in the early 70s with primary interest in community health care, I found myself not always on the same wavelength with my colleagues, particularly those in the medical school. But I certainly was on the same wavelength as Ruth and Milton. Ruth became a mentor and a friend. She was always interested in whatever I was doing, from getting the Venice Clinic operational to working on smallpox eradication with WHO, to working in refugee camps and in the anti-nuclear movement. She wanted to know the nitty-gritty details of the grassroots work. I was so fortunate to spend many an evening at Ruth and Milton's home, where they hosted dinners with fascinating, socially committed people from around the world and across many academic boundaries. They were memorable evenings, and I also had some of the best meals of my life there, because Ruth was a fabulous cook. Sarah Shannon has lots in common with Ruth Roemer. She sees the big picture. She has very similar values, and she doesn't run from the really tough issues. She works incredibly hard and accomplishes more in a day than anyone I know. She has boundless energy, and like Ruth, she walks down the hall at a pace that few people can keep up with. I met Sarah at UCLA in 1981. She came to see me about doing some international health work, and within hours I had her volunteering at the Venice Clinic. And within weeks I had her on the way to Honduras to work in the refugee camps for the Salvadorans, who were at that point in 1981 flooding into Honduras. The camps were dangerous, the conditions were terrible, the refugees were unwelcome in Honduras. It was to be a very short assignment, but Sarah stayed in Central America for 15 years, following the refugees back into El Salvador finally when there was repatriation. She trained community health workers. She did basic public health work with water, sanitation, nutrition, and she also did political advocacy. She saved lives daily, often at risk to her own life. On the first trip, I gave Sarah a suitcase full of essential medicines that were needed there, and another suitcase full of a book called Donde No Hay Doctor, Where There Is No Doctor. A few years earlier, I'd heard about this book and gotten one of my medical students who was doing an elective in Mexico to track it down and get me a copy, and she brought it back, and I found to my amazement it was published in Palo Alto. And they were about to do an English version. A health book for the third world. That was exactly what I had longed for. I carried the book then wherever I went, and I think I probably introduced it into at least a dozen countries. By the mid-90s, I joined the board of Hesperian, which was struggling and about to go under. And in 1995, I found myself board chair and desperately hunting for an executive director. Sarah answered the call, and for 18 years, she's been the best executive director I have ever encountered. She brought the organization back from the brink and developed a new process by which books are written, tested, reviewed, and revised with the grassroots health partners worldwide. Books are now available in 220 countries and territories and in over 80 languages. Where There Is No Doctor has been updated continuously, and 12 new books have been written, revised, translated, and distributed worldwide. The titles tell the story: Where Women Have No Doctor, A Community Guide to Environmental Health, A Worker's Guide to Health and Safety, Helping Children Live with HIV, Helping Children Who Are Blind, Helping Children Who Are Deaf, Actions for Women, just to name a few of them. She directed the development of Hesperian's online health wiki when we entered the digital age, and that now reaches 3.5 million people a year and is in 12 languages. In her spare time, Sarah has been a driving force of the People's Health Movement, a global network of grassroots health activists serving as North American, and she serves as North American representative to their Global Steering Council. Like Ruth and Milton's home, Sarah, Todd, and their daughter Celia's home is a gathering place for health activists from all over the world. The Ruth Roemer Social Justice Leadership Award is named in honor of Ruth Roemer for her 70 years of extraordinary service and contributions to social justice with lasting national and international impact. The award is presented to an individual who has shown commitment to social justice issues through outstanding service and support of vulnerable populations and whose work is replicable and scalable. It is therefore with great pleasure that I present the 2015 Ruth Roemer Social Justice Award to Sarah Shannon.
This is actually a really moving award. I want to thank the UCLA School of Public Health Alumni Association for this award. I'd actually like to appreciate my Todd Jailer, my partner in life and work, who's here along with my parents, and Davida Cody for those really moving words. Thank you, Davida. It's, as Davida explained, it's really meaningful for me to receive this award from her today, given that she and I first met in the halls at UCLA in 1981, and that moment ended up being one of the key events that propelled me in the public health work that I've done ever since. First, the Venice Clinic, and it's just an honor to have someone from the board of the Venice Clinic right here with us too, to the refugee camps within a few weeks. And as Davida explained, she gave me my first copy of Where There Is No Doctor. As I was heading to the airport to work with Salvadoran refugees crossing the border. And that book, I leaned very heavily on it as I did water, sanitation, set up emergency feeding programs, trained community health workers from members of the community so that they could promote health with their neighbors, and helped them find creative ways to share health information with others in a way that would reach them where they were, and generally supported them doing community organizing and learned a great deal from them. In the process, I became a convert for life to the idea that accessible, practical information that can enable people to act, not just to improve their own health, but motivate them to work with others, to organize at a community level to address the underlying causes of health. And I think that today's event is going to give us a really interesting spectrum of exactly that. I'm deeply honored to receive the Ruth Roemer Award today. One aspect of Ruth's amazing career that resonates for me was her insistence on a broad view of public health. Her determination to work across disciplines and to do so in a way that would consciously address what we now call the social determinants of health and she really deserves so much credit for that, to address the underlying cause of poor health and health problems. This is frankly why I do public health. I suspect it's why many of you in this room do too. My experience is that people, especially those who are marginalized and poor, in fact, know and see these connections very clearly in their own, it's part of their own life experience. And we can take a lot and learn a lot from that. Health Actions for Women, which I'm going to do a little bragging about, is a brand new book that I'm proud to have been involved in writing, based on the experience of community organizers around the world who shared activities and strategies that were then field tested and tried out by over 1,400 women, men, boys, and girls. And for example, in a way to address the underlying causes of gender equity and issues that really impact women's health. For example, we included an activity that can be used with a group to look at how status and difference in status due to gender, race, age, ability, education, income, how that can create power differentials in a community and how that impacts health. Now, those are hard issues to deal with at a community level. But that activity was proposed and contributed to us by a group of garment workers from South Africa. I tried it out with a group of community college students here in Los Angeles quite successfully. Most importantly, those garment workers from South Africa and others who contributed to this process also shared their ideas of how to take that intersectional analysis and use it to move a whole community to look at how to build solidarity so that everyone's health can improve. And that's powerful. Health Actions is filled with activities like this and practical ideas for how to address the really hard stuff like gender-based violence, like income inequality for women, as well as promoting safe pregnancy and health services that actually meet the needs of women and girls. This book and all of Hesperian's other work is filled with the wisdom, the real wisdom of community health organizers and health promoters. And it's meant to be shared across borders and cultures. Now back, when I started my journey in public health over 30 years ago, that sounds so long ago, we talked about something called international health, and I think, in fact, one of the courses Dr. Cody taught was that. Now it's clear that this boundary no longer exists. Migration, climate change, urbanization mean that the epidemic of diabetes that we're battling in California is shared by our partners in Honduras, the Philippines, Zambia, or that a virus like chikungunya has moved from India to the Caribbean and is now rampant in Central America and moving into the US. Another example, though, is an epidemic of a different sort. It's the political backlash against women's health and reproductive rights, occurring right now in Latin America, and in the United States we are not immune from this issue as well, where women's ability to access family planning and, should they need and want it, access safe abortion is under attack. A few years ago, Hesperian put all of our health information online, as Davida mentioned, in English and Spanish, and making it available for free. And it's getting a huge amount of traffic. Nearly 700,000 people accessed it just this past month alone. What's really interesting and what we've been astounded by, however, is that month after month after month, the topic most heavily accessed and read is the information related to safe abortion. And the second and third most heavily read topic is family planning. Now maybe this shouldn't be a surprise, but we have been astonished. It's particularly true of people coming to this site from Mexico and other parts of Latin America, but we have a high level of traffic on that content from Texas, not surprisingly, and I suspect we're going to start seeing it from other states as well. Now, I'm proud that we are providing this kind of critical information, and we're certainly committed to continuing to do so. But the challenge we all face is how do we fight back and not only protect but advance these hard-won rights, these human rights? How do we not only ensure that access to family planning or safe abortion is available in California, but also in Texas and Indiana, across the United States? And how and everywhere else, in fact, around the world. And how will we do it in a way that providing these rights also goes hand in hand with ensuring that everyone has access to health care and that right? Now, I think we know the answer. Public health is people's health. And doing public health means working with people. It means community organizing. It means getting politically active. And it often means working under challenging conditions without enough resources. So when we organize against the marketing of junk food in schools in California, we're actually helping to lead an effort that will cross borders and inspire others in other parts of the world. When we call for a ban on fracking, we're joining a much larger struggle for people's health against a powerful global industry. And when we protect our food from chemicals like the pesticides in Roundup that the European Union has declared as carcinogenic and which poisons our land and our food, we're also helping to make food safer and healthier everywhere. And when we in California provide health care to everyone regardless of their immigration status, we're setting an example for others to follow. This is public health at its best, in the broad way that Ruth Roemer exemplified. And I'm grateful to Ruth Roemer for her trailblazing, and I thank you all for the work that you all are involved in to make the right to health a reality. And I thank you for this really remarkable recognition and award. Thank you. And I just wanted to say that I'm gifting a larger library than this actually to the Global Media Project, because the idea of how information reaches people and how to do so in an accessible way is a really shared mission, and it's my pleasure to do so. So thank you. Should I take this?
Hello, my name is Armina Dulejian. I am a graduate of School of Public Health about over 10 years ago, Department of Epidemiology. I'm here to, actually it is my honor and absolute pleasure to introduce today's keynote speaker. Dr. Neil Baer is a Harvard-trained physician, pediatrician, and award-winning television writer and producer. He was the first physician television writer in Hollywood and has a unique perspective to tell stories from a physician's point of view. He combines his passion for medicine and storytelling to challenge audiences' views on spectrum of social and political topics. More specifically, he focuses on storytelling to make social change and promote public health globally. Prior to his work as executive producer of Law & Order Special Victims Unit, which has received 6 Emmys and a Golden Globe for acting, and executive producer of the NBC hit series ER, where he received 5 Emmy nominations as producer and 2 for writing. Dr. Baer joined the Department of Community Health Sciences at UCLA's Fielding School of Public Health as a research scientist in 2013. He recently established the Center for Storytelling, Activism, and Health at USC's Institute for Global Health. Now at UCLA, where he's working on projects using new media to promote health initiatives around the world. In addition, he's also a senior fellow at USC's Annenberg School of Journalism. Dr. Baer's recent works include an app called Action Lab that allows people to take actionable steps whenever inspired to make change. He also has recently produced If You Build It, a documentary which tells the story of high school kids building a farmer's market. Let's please welcome Dr. Neil Baer.
Good afternoon. Congratulations, Sarah, for your inspiring work, and thank you to the Endowment, whom I've worked with over many years, for sponsoring this event. It's an honor to be here today to celebrate the legacy of Ruth Roemer, a passionate teacher and advocate for those with mental illness. Ruth outlined the first public health treaty to combat the tobacco epidemic and fought tirelessly for reproductive rights, as you've heard. So it is in that spirit of her lasting impact that I speak today about the most powerful tool we possess to continue the cause of Ruth's work, promoting public health. And I believe that power lies in storytelling. Although you may not have considered it, public health advocacy is based on storytelling. How many times during the day, in the field, with colleagues, teaching students, or in your own personal lives, do you tell a story? Facts and figures compiled in policy reports or health journals organize the world in ways that make it possible for us to grapple with the complexity of social issues. But do those journals, often piled up on your desks, engage us emotionally and intellectually in the ways a good movie, novel, play, or television show can? There's something about watching characters duke it out over their differences that captivate us like nothing else can. We sit rapt as characters battle over the ethical dilemmas of our times. As a television writer and producer, I've been privileged to bring these stories to millions of viewers. And I take that role seriously by trying to be as accurate as possible, since viewers believe what they're seeing is true. For inspiration, I take my private stories and I make them public. So what does that mean? Well, I, as a pediatrician, saw children, for instance, coming into Children's Hospital LA with gunshot wounds. Or I've seen what happens when kids aren't vaccinated. So I take those private stories and I make them public. So I'm going to give you a few examples of how I did just that.
But you didn't think about how your choice would affect other children.
Sierra Walker isn't my child. I can't make choices for her.
But you did. You made a choice and now she's dead. Your actions are directly responsible for her death. If she hadn't contracted measles, she would still be alive.
Is there a question here, Your Honor?
Is there, Miss Cabot?
Miss Stewart, what is your medical degree in?
I don't have one.
But you were making medical choices on behalf of your child.
Just because I don't have a degree doesn't mean I can't be an informed parent.
You chose your informed opinion over that of people who do in fact have a medical degree and understand the science behind vaccinations and recommend that all kids be vaccinated.
I know what's best for my child.
If you know what's best, and the doctors are of a different opinion, then it stands to reason that they don't have your child's best interest at heart.
Their science is just another opinion.
Your opinion killed a little girl.
Your Honor.
I'm just trying to show that if Miss Stewart had vaccinated her child, Sierra Walker would be alive today.
I'm not sure that's true.
You're not.
That woman was a horrible mother. It was just a matter of time until something tragic happened.
You're the one on trial, Miss Stewart.
Exactly. And how fair is that? I'm the good mother. I make sure my child eats well, is taken care of. She buried her daughter in a shallow grave.
Yes. She buried the child that you murdered.
So that was an episode where a mother did not vaccinate her child, as has happened recently in Disneyland. And a little girl was exposed to that child who was under a year old. We don't vaccinate children under a year old. And that child contracted measles and died. So we got to put, being a writer, I got to put the mother on trial. And for murder. What was really exciting about that was to redefine the question, really. So we think about vaccinations in terms of ourselves as parents, and I have a son who was vaccinated. And there are many people who feel, without looking at the data, my favorite line I ever have written is when the mother says science is just another opinion. It's very difficult to argue with that. But nonetheless, science does show that vaccines are protective. They do not cause autism. But I wanted to redefine the question, and redefine the question by not talking just about our own responsibility to our children, but what is a parent's responsibility to the community of children? And when we redefine the question, then the outcomes can be different. And we often focus on one road and one question, like what is my responsibility to my child? But if we start to think about children as the community of children, then we begin to think of vaccinating in a different way, that maybe as Sarah just said, maybe my actions have a profounder effect than just on my own child, but on the community of children. And so that did get people starting to talk. I got a lot of mail, as you can imagine, about that episode. So I also like to draw on the latest research to bolster my own private stories and making them public. So I'm going to show you a piece from SVU that was literally drawn from research from Science magazine, not just another opinion.
Some of you might think that Nathan Phelps acted out of simple vengeance. Ted Carthage murdered his mother, so he murdered Ted Carthage. That is what the assistant district attorney will argue. She will tell you that anyone who kills out of retaliation should go to jail. I agree with her. But that is not what my client did. Did he hate Ted Carthage? Absolutely. Did he kill him? Yes. So if not out of retaliation, what made Nathan do it? This is a new study published in Science magazine. It found that people who have witnessed gun violence are twice as likely, sometimes 3 times as likely, to commit an act of violence themselves. Nathan witnessed Ted Carthage shoot his mother. And just as this study predicts, he reacted with violence. This study equates gun violence with an infectious disease. Anyone exposed to it is infected. Now, you may not agree or like this study. Gun manufacturers don't like it either. It goes against their mantra. Guns don't kill people. People kill people. But this study points to something that is almost unspeakable in today's gun culture, and that is that the blame for violence can be directly placed on the gun. Once you see someone squeeze the trigger, it's easier to do it yourself. Nathan saw his mother shot to death in front of him, and at that moment, he contracted the disease. It wasn't his choice any more than it is your choice to catch a cold after someone has sneezed on you. Violence is the disease. Guns are the virus. And we have an epidemic on our hands.
So, I would love to show that to the NRA sometime. I don't know if they would clap. But it was interesting because it redefines, again, the question. The question as public health advocates and academicians that we struggle with is how to make the story resonate. And I was able to do that, or at least I tried to do it, on my show by taking an actual study that posited causality. Dr. Feltnerl is a psychiatrist at Harvard, published that article, and he controlled for SES, urban, rural, single-parent families, and found that children exposed to gunfire, actual gunfire, are 2 to 3 times more likely within several years to commit a violent act. So, do these shows make a difference, though? They may have engaged you just now, and emotionally and intellectually, but am I just chanting to the wind? And Paul Slovic, a researcher and professor at the University of Oregon, says no, that in fact we are moved by stories. Most often stories of 1 or 2 protagonists, but we are not moved by data. So that's why I feel very fortunate to be able to tell stories that are dramatic, that emotionally resonate, and then we can go to the data for support and to illustrate policy perspectives and different routes we can take to solve the problem. So stories, as Slovak says, are the currency of our lives. They're the measure of our days. We're nothing without our stories because stories encapsulate our fears, our failures, our dreams, and our desires. We understand and make sense of our own lives by telling stories about ourselves and others. People who can't tell stories, for example, those afflicted with advanced Alzheimer's disease or Korsakov's, are lost to us. So TV dramas are, for me, more than just an escape from our daily lives. They are the touchstones for our emotions. Stories guide us. They are ways for us to make sense out of all the facts and figures and arguments we hear about things like the growing rate of childhood obesity, whether abortion should remain legal, or why 1 out of 3 women who enters an ER is the victim of domestic violence. Stories shake us up, make us see other points of view through characters we can identify with. And if the show is really good, we continue to think about it, turning it over in our minds, savoring it. Maybe we even begin to think about things a little differently from the way we had before. The way we had thought about them before. I think stories on TV captivate us because we see our own lives and the characters' struggles. We sit and root for some, loathe or love others. Stories are stand-ins for our own fraught-filled lives. They offer relief, an hour to step away from our own dramas, and yet they can work on our psyches as we watch, offering us new perspectives or bolstering our beliefs. Stories have the power to move us emotionally, stir us intellectually, and teach us too. One of the reasons I enjoyed writing SVU is because I took roiling social policy issues and transformed them into what I hope were compelling and engaging stories. Public storytelling requires us to draw on our personal experiences and stories as health promoters and to bring them to public attention in order to improve people's health and lives. But does public storytelling make a difference? Can our patient stories actually improve public health? A resounding yes, and I'm convinced that through storytelling we can be motivated intellectually and moved emotionally to take action. Now here's the proof, because, you know, we are folks who do deal with data. So I did a show in 1999 on ER, which was the first experiment where we did a piece on human papillomavirus and cervical cancer. And we did a study where we surveyed a random sample of viewers, over 1,200, by Princeton Survey Research. It was funded by the Kaiser Family Foundation. And we asked people and assessed their knowledge about human papillomavirus and cervical cancer. This is before Gardasil came out, the vaccine. Then the show aired, that was the treatment, and then we resurveyed a random sample of viewers because I wanted to know, does it make a difference? You know, our stories, what can change attitudes, views, and perspectives? Whoops. So here we go. So we found that 53% learned about important health issues from our show. Half talked about it with their family or health issues with their family or friends. A third got information that helped them make choices about their own family's health care, which is why Sandra Buffington, whom you'll be hearing from shortly, runs a program to provide TV writers with accurate information, because people really believe what they see, you know, they think what we're saying is true. So I think it's incumbent on us to be accurate. A fourth went to other sources, and probably more do that now. This was in 2000 because of the internet. And 1 out of 7 contacted their doctor. So this was the first study where we really gave me pause, like, wow, I have to be as accurate as possible. Percent who could correctly define HPV, about 9% could define it accurately. I think more would now because of Gardasil and Sarah Palin. Or not Sarah Palin, sorry, Michelle Bachmann. Well, Sarah Palin too. Michelle Bachmann too. But then she was shown to be wrong, that it did not increase sexual activity amongst young women. We needed the data, of course, to show that, and I think that that's where data come in. 28% knew after the show aired, so more than 3 times, and then it dwindled down to 16%. So they need boosters, as we know in communications research, or repeats, which are still on, unfortunately. So, and we had 40 million viewers at that point. So, and then most excitingly, 19% knew HPV caused cervical cancer before the show aired, and 60% knew after, and it went down to 40%. You have to have the information in order to change your behavior. If you don't know that HPV causes cervical cancer, then you won't take protection, you won't use condoms, you won't get pap smears, etc. So this really did give me pause, and I try after that to be as accurate as possible. The possibilities for telling stories that can make a difference are limitless. Stories can light a fire, focus us on problems that numbers alone fail to do. So now that we have the internet really entrenched in our lives, I was thinking, how can I use it to really reach out to the audience? In the past, it was unidirectional. I made the show, you consumed it, maybe you wrote a blog about it, but there wasn't a multi-directional approach. Well, of course, now there is with Twitter. When I'm doing my show Under the Dome, I get on well, we were on Monday nights, now we're moving to Thursday at 10, June 25th, 2-hour premiere. And I tweet with them, and then they tweet back, and I answer questions. So some years ago, about 6 years ago, I was at a dinner, and I heard a story about a young woman who was raped and underwent a 7-hour rape kit, which is the technique used to gather data and evidence after someone is sexually assaulted. And it is a very invasive, as you can imagine, procedure. And what I found out that was shocking to me was, from this woman, that her rape kit was not ever tested. And how can that be if she underwent that extreme, first of all, the situation of being assaulted and then going through the kit. And then I found out, as I did some research, that 400,000 rape kits were not opened in the United States, which then said that we were sending a message, as you'll see in a moment, to the perpetrators that we didn't care, and and that they could do what they wanted, and to the victims that we didn't care as well. And the reason it was important, and it is important to open the kits, is because most perpetrators have done something in the past, or a large number have, and so they're in the system. And so this woman was afraid to leave her house. I was so moved by her story that I wrote this episode of SVU. And then I thought, well, I have the episode, but now I can reach out. So what I did is called a bubble tweet, and I took 30 seconds of it, and I then made some partnerships, but I'll tell you about that in a second. I'm just going to show you this 30-second tweet.
In Houston, they have a backlog of 4,000 rape kits. He says he'll get me the results when he has them. Birmingham, more than 2,000 rape kits. Phoenix has 4,100 untested rape kits.
We've counted almost 7,000 kits. We think there might be as many as 16,000 kits here.
Have any of them been tested?
So far, only about 1,200.
I wonder how many guys like Harris could have been stopped if those rape kits had been tested.
Until they are, everyone is just a victim who'll never get justice.
It's like we're telling them that they don't matter, and we're telling the perps that they can get away with it.
Yes, Olivia. So, Mariska and I wrote, yeah, really. We wrote a piece for Ending the Backlog in the Huffington Post, and we partnered with Nick Kristof. You can see in the first one he talks about every 2 minutes someone is raped in the United States, and then there's a bit.ly, and if you clicked on that, that went back to this little clip. And then we partnered with Human Rights Watch as well, and we gave actionable steps people could take. Because people get inspired, they get engaged, and then they want to know what to do. And then in the past, they were left up to their own devices. Now with, as was mentioned, actionlab.org, you can connect after you see something to actionable steps. So the actionable steps that we designed were going to your a kit that helped you go to your chief of police and to your city council members to open the backlog of rape kits. They were all opened in Los Angeles. The New York Times, if you're interested in this arena, has been chronicling the work that's being done in Congress as well, opening the kits around the country, and it is happening. And people are getting picked up off the street and stopping the crimes from continuing. We also partnered with all of these other organizations and media to get the message out. So you can see that there are many ways to now work with new media to augment our message. So here's my challenge to you today as you celebrate the wondrous work of Ruth Roemer. As your head hits the pillow and you close your eyes, think about a story that moved you in your training or in your work, and ask yourself, is it right? Allow me to share a few of mine. 13 million children in Africa have rheumatic heart disease, strictly because they have no access to penicillin. Is it right? Many mothers infected with HIV must still make terrible choice between breastfeeding their infants and exposing them to infection or using contaminated water to make formula. Is that right? Over 40% of children in Los Angeles are obese, yet many don't have access to fresh fruits and vegetables, though inexpensive junk food like hot Cheetos and Pepsi are plentiful and are on billboards on this side of town in Spanish. Is it right? For under 50 cents a day, millions of children across the world could be treated for parasites, which we know, evidence-based, lowers IQ, stunts growth, and keeps those infected children out of school. Is it right? Each of you has a private story to tell, a story that has gripped you, changed the way you thought about the world, or moved you to tears. Take your stories about domestic violence, drug abuse, HIV, access to health care, needle exchange, alcohol abuse, and make them public. And you all do that, but now you have new ways with transmedia. You don't have to be a television writer to have an impact. Write op-ed pieces, work in grassroots organizations, you're already doing that a lot. Testify before the legislature, run for the Senate, debate your enemies, march for justice, stand for truth, teach, blog, and tweet. Use mobile phones in new ways to improve people's lives. Did you know a class at Berkeley recently devised a way to attach a small microscope to a cell phone so that a blood smear can be sent to a lab far away? Think about how that can improve treatment of malaria. Or did you know that someone invented eyeglasses that cost less than $10 that can be refracted by hand? Take your private stories and invent new ways to treat patients. Devise ways to use new media to inform the public about breakthroughs that can improve people's lives. Take your stories and your passions and turn them into potent barbs to fight dogmatism and bigotry. Use your private stories that stir you and tell them any way you can. Invent new ways. Use the tools you've learned here and speak out. That is your mission, to improve people's lives. You've got stories to tell, and many new ones will come along that will rankle you and move you and become unforgettable and fill your hearts. Tell me your stories. Thank you. Do we have time for questions, or do we have time for questions, or? Oh, great. Thanks. Great.
Thank you so much, Neil.
Sure.
Amazing. And we'd like to take a couple of questions from the audience. Is anybody brave enough? Yes, we have one.
Oh, thank you. Thank you. The hardest meaning because the network had trouble with it, or for me, myself? The hardest one, they were never really hard to write. I was like, that's what's so interesting. I was really fortunate because they also wanted the evidence. I did stories about HIV deniers. There's a very famous professor, I guess you call him that, at Berkeley, who says it's not a virus, it's a nutritional defect. So we took that on. We took on foster care, homeschooling, LGBT issues, transgender kids, you name it, we did it. And as long as I had the data to show, like I did in the gun violence episode, that this was a study from science, or when Sandra helped me, I actually called her and said, where are measles outbreaks in the United States? When was the last time a child died from complications from measles? How many kids are not vaccinated? As long as I had that information, that data, I was able to write anything I wanted. So I really, the only time I was censored was once, and it was on ER. And it's because, and now this has changed a bit, but we had a story about a young woman who comes in and she has tried to commit suicide by taking an overdose of Tylenol. And a lot of, it seems to be a drug, unfortunately, of choice for young women because they think it's harmless, and it's not. It causes fulminant liver damage if you take not many. And it wasn't labeled in that way as it is now. And so she was a young woman who had, she had tried to commit suicide because she was the victim of incest, and her father finds out about what happened because the nurses are talking in the elevator. Very bad thing. I heard nurses once talking in an elevator, so I was like, I better put that on the ER. So, and doctors too. They're even worse. So NBC said, you can do incest, you can do suicide, but you can't say Tylenol. So they said, you can say acetaminophen. So Anthony Edwards, who was the star of the show, said, no one's going to understand that. And so he said Tylenol, and even now, it just goes. And so that was the only time that we were ever, to my recollection, censored. No.
So I just wanted to know, are there others like you? I mean, when you think of producers and writers of other shows, I mean, you're a medical doctor, so I mean, who would have imagined a medical doctor is writing, television series? But I mean, are there others like you? Can we think of other shows that are, doing something similar, or other writers that are doing something similar? I mean, you have so many popular shows. I think of this show Empire that's out right now, and some of the, messages that could be, introduced there. I mean, do you think that's happening? Do you know?
It's beyond thinking. It's happened for, I don't know, the last 10 or so years through the work that Sandra has done. So I'll let Sandra answer that question, because that's what Sandra does. So.
There is no one like Neil Baer in Hollywood. He's unique, seriously. So, yes, thank you. Yeah. And thank you for all you do, Neil. Because Neil's work goes way beyond his work on whatever TV show he's executive producing. And he uses that as a platform, as you saw today. But he also makes documentary films. He empowers people in developing countries to become storytellers themselves. He gives cameras to children who've been orphaned, so that they can tell their stories. He works with HIV-positive mothers and empowers them to tell the stories of their lives. And so he's on every board in LA. I don't know how he does all that he does. He's remarkable, and I'm so proud of you.
Thank you.
But that said, we actually at the Global Media Center for Social Impact work with most of the shows you'd know on air today. So we had 565 health storylines air on 91 TV shows across 35 networks in the span of 3 years. And so there's a huge appetite for the kind of inspiration we provide by connecting writers and producers to people like you in the room, experts in public health and well-being on social justice or social determinants of health. They want to meet you. They want to know what you know. They want to be inspired by you. They want to check their scripts to make sure they're getting their facts right. And if they don't want that, we provoke them until they do want that. And so
with the data that we show,
exactly,
that it makes a difference. And Sandra, and what's important, Sandra didn't mention, is that she's published, I don't know how many academic articles on the impact of other shows. So it's on obesity, on organ donation. She has all the data. And as I found when I did the study on HPV, she found that 10% of viewers who saw an episode of Numbers on organ donation signed up. So it has an impact, especially when you, as Sandra likes to talk about it, transport people without preaching or saying this is good medicine for you. We just integrate it, as you saw, into the shows, and it comes out dramatically. And then you can, as I said in my little talk, you can kind of see all the sides. That's what's so great about drama. It's not just one side, but it's all the characters have different points of view.
Thank you so much, Neil. I think we're going to close the Q&A session right now and continue.
Thanks.
Thank you.
Thank you.
Hello.
How are you doing? All right, we are blessed to be here today honoring Dr. Roemer and her work and all the wonderful speakers we have today. I was given the task of introducing Sarah. Sarah's not here. Sandra's here. Sandra de Castro Buffington. Sandra de Castro Buffington, named American Riviera Woman Entrepreneur of the Year by the World Film Institute in 2014, is a global leader in entertainment for social change. As the founding director of the Global Media Center for Social Impact at UCLA's Fielding School of Public Health, Sandra unleashes the storytelling power of television, film, music, and new media to improve health, social justice, and the well-being of people worldwide. Sandra works closely, as you can tell, with Hollywood and other creative capitals to inspire and develop storylines that have profound impact on knowledge and behavior, and creates new media tools that move audiences to action. Her research measures the impact of storytelling on viewers and maps the pro-social content on top TV shows. For her work, Sandra was named one of the 100 most influential Hispanics in America by Poder magazine in 2012. Now, I have to read that again because I was blown away. That's what took me so long to get this out of my mouth. For her work, Sandra was named one of the 100, not 1,000, not 10,000, but 100 most influential Hispanics in America by Poder magazine in 2012. So when I was asked to do this, I said, oh my goodness, I knew this woman was good, but I didn't know she was this good. Sandra's vasectomy campaign in Brazil earned 7 international advertising awards, including a Bronze Lion at the Cannes Film Festival and gold medal at the London International Advertising Awards. Former director of Hollywood Health and Society, Sandra created a global network of centers, including India and Nigeria, with a hub in Hollywood to improve the accuracy of health-related storylines in top TV shows and films. Okay, her groundbreaking work resulted in, now she mentioned this statistic, but I want you to repeat after me when I say this. 565 storylines.
565 storylines.
That aired on 91 shows.
91 shows.
Across 35 networks.
35 networks.
In 3 years.
In 3 years.
Wow. Say wow.
Wow.
All right. Please join me in welcoming Sandra de Castro Buffington. Thank you.
Thank you so much, Lisa Smith. I have never had an introduction like that, and I had a great time. And I'd like to thank the California Endowment for organizing this amazing event. I have a privilege today of introducing our extraordinary panel of experts. And before I do that, I just want to say a word about the Global Media Center for Social Impact, which is in the Fielding School of Public Health at UCLA. And the dean invited me to found and direct the center just a year and a half ago, and Neal is my co-founder in it. And we created the center because we recognize the tremendous power of storytelling to impact knowledge and behavior and shape attitudes around the world. I'd like to let me just say, we're a bridge between the entertainment industry and public health experts and social justice experts. And so we create a lot of different ways of connecting you and interacting, having the writers and producers interact with people they might never meet otherwise. And we actually created a story tour series to take writers and producers into communities to meet local storytellers on the ground in their context, in the place that they live day in and day out. And begin to be inspired by local leaders and civic innovators and social entrepreneurs. That's how we inspire them to create storylines for television and movies. Now I'm going to throw a few data points at you. 10.3% of viewers signed up to become organ donors after seeing an organ transplantation storyline on the show Numbers. Viewers of a storyline on rape in Congo on Law & Order SVU had increased knowledge regarding immigration, asylum, and sexual violence. They changed their policy priorities towards global health policy priorities, and it increased discussion of global health issues among viewers. 11.9% of viewers reported scheduling a doctor's appointment to talk about breast cancer risk after seeing a BRCA gene storyline on the show 90210. 90210 did an 8-week story arc on breast cancer and the BRCA gene that we consulted on. Over 8 million viewers learned for the first time how to prevent mother-to-child spread of HIV from a single episode of Grey's Anatomy. Storytelling is powerful. And with that, I'm going to introduce our extraordinary panelists. And I'm going to start with Dr. Franklin Gilliam. And if you would come up as I introduce you, that would be tremendous. Dr. Gilliam is the Dean of the UCLA Luskin School of Public Affairs. His research interests, you come on up. And
I'm trying to figure out which one I was.
You're right there. Okay. Dr. Gilliam's research interests include strategic communications and its effects on shaping public policy, electoral politics, and racial and ethnic politics. He is the author of Farther to Go, Readings and Cases in African American Politics, and his work has been published in many leading academic journals. Dr. Gilliam is a senior fellow with the Frameworks Institute, where he has served as project director for the Framing Race in America project, and he's contributed to programs on healthcare, early child development, youth and rural issues, and criminal justice. Dr. Gilliam also serves on the boards of the United Way of Greater LA, Blue Shield of California Foundation, and Southern California Grant Makers. He received his BA from Drake University and his MA and PhD in political science from the University of Iowa. Let's welcome Dr. Franklin Gilliam. And I'm going to introduce all of our panelists, and then we'll hear from each of them. Now I have the pleasure of introducing Juan Devis. He's the Senior Vice President of Content Development and Production for the largest independent television network in the United States, KCETLink. Juan has also charted the station's New Arts and Culture Initiative and is the executive producer of the Emmy winner Artbound, consisting of a television series, an online networked cultural hub, and the creation of programmatic partnerships with cultural institutions. Juan is a founding member and a board member of the LF Charter School for the Arts, an innovative arts-integrated charter public school. Juan's film, television, and interactive work has been screened and exhibited across the world. And in the press, Juan Devis was presented as a major influencer in LA by the LA Weekly, and his transmedia series, Departures, was celebrated by the New York Times as a new twist on public media. Let's welcome Juan Devis. And last but definitely not least, let's welcome David Valdez, who began his Y career in 2012 as the inaugural director of the Youth Institute for the Weingart East Los Angeles YMCA branch. With his help, the site launched a series of media-driven programs. I love it. Wait, I want to be in that. Okay. Okay, wait, we're taking a selfie. Thank you for the pause. With his help, the site launched a series of media-driven programs that use the learning of production and media skills to improve the academic achievement of youth in Boyle Heights and East Los Angeles. David champions for youth development on the East Side and has helped several young people earn recognition for their productions with the Youth Institute. To date, those honors include the Cal State LA Golden Eagle Community Media Award, Eagle Award for the Best Teen Magazine, second place in the Youth Institute International Film Festival, and Best Youth Produced Video at the 20th anniversary of the San Diego Latino Film Festival. Please join me in welcoming David Valdez. And now I'd like to invite Dr. Franklin Gilliam to make his remarks.
Good afternoon. Good afternoon. Thank you. Wake up here. All right. I'm thrilled to be here today. Join my colleagues from the Fielding School at the Ruth Roemer Symposium. I think it's one of the really important and significant events that the Fielding School does, and I think it pays tribute to the kind of scholar activists that many of us aspire to be. So, and want to thank the Endowment, and B, thank you for putting this together. So I'm a political scientist, as you heard, so you're wondering, why am I up here talking to a bunch of health advocates and health scholars? And it's always a daunting task, of course, being the least knowledgeable person in the room, but that's not going to stop me from doing violence to your field. So, much like Neal, I believe in the power of storytelling. I come at it from a bit of a different angle. I'd recommend a book to you by a guy named Roger Schenck called Tell Me a Story. And in it, Schenck argues and demonstrates that human understanding is story-based, right? We don't understand descriptively. That you're not going to go home and say, what did you do, dear? I parked my car, I walked into the building, I opened the door, I sat. You're going to tell a story about the event. I saw clips of Law and Order, or the guy who writes it, or had a great lunch, or whatever it is, but you're going to tell a story that describes what you did here today, and it is what structures your understanding. So I agree with Neal on this idea that storytelling is important to human understanding. Where I diverge, and this is just another slice at this, is my goal is not in individual behavior change. Rather, my goal is in systemic change. And I think we would explain why Neal and I come at this probably differently. So my goal is to move public will in such a way by shaping the public discourse that we get policy and programmatic change. And so that's more of what I'm after, not individual level change. And so I'm just going to start here, and you're going to hear me talk a bit about framing, and I'm going to try to do a 85-slide presentation in 5 slides, so let's see how this works. I've always loved this quote by Snow and Benford about social change requiring a master frame, a master narrative, a master story. And the failure to develop one, they argue, even when conditions are otherwise ripe, is what leads to failure to produce social change. I'll let you read this and let it sink in a bit. But it's this idea that, and we hear it all the time, that controlling the narrative is extraordinarily important to producing the kinds of policy change you seek. Let me give you an example. Some of you are old enough to remember that when Bill Clinton was first elected in 1992, he was elected on a mandate to do what? Health insurance, reform health care. People forget about this. What happened? A disaster. Was the symbolic event that many people remember and is captured? So if you know, it went through a couple of iterations. Ultimately, Hillary takes it over. They come to Congress with the reforms, and there's a famous picture of congressional staffers pushing carts with massive stacks of paper on them. And that very simple message was bureaucracy. Reform's complicated. So they came in with a mandate to do essentially what Obama did, but what Snow and Benford would argue is that they didn't have a master frame, and in fact they lost control of the public discourse around this. So this is just one example of why this is important. Now, there's a reason policymakers, and particularly politicians, poll all the time. Right? They want to get ahead of where the public is going to be. This is how you survive in politics. And here you see it's about where the political will is, how much passion there is around the issue by a wide enough audience. And essentially what he's saying, the politicians and the policymakers say, uh-oh, this train is moving, I better get on, right? And so it's something out there, something somewhat ephemeral, but still measurable, that influences the actions of elected officials and policymakers. And in particular, it's this idea that public will is shifting, that the discourse has changed in such a way to pedestal a different kind of policy agenda. And what I'm going to talk about a little bit here is about framing, and in particular, make the following point that is not without some controversy, but that is communications is more science than art. It's not that there isn't any art to it, but I argue it is more science than art. So you even saw Neal try to show you some science, right? Where he did some experimental work. I mean, we might quibble. The reason he gets duration effects, he's got a show that's on for 30 minutes, and as opposed to an experimental treatment that's 5 seconds. But the point is that things move, right? And there's a science to it. So if you say, and it's causal, right? It's the beauty of these experiments. He knows, more or less, that exposure to that show caused a shift in attitudes and a shift in understanding. And it had some durable effects. So I could go on about the science of communications, but I think where advocates sometimes go wrong, and I've trained probably now thousands of advocates over the last 20 years, is that they think there's some magic bullet. They get somebody to give them 2 focus groups, and they say, the focus groups people tell you to say, they stick the finger in the air and come up with some word. And there used to be an old saying, right? And several people in the room were probably old enough to remember this. There's an old Madison Avenue ad gag, say plastics, if you can remember. They used to tell them, it's all you had to say in like Mad Men era, say plastics when things got tough. Well, they'll say anything. They'll say social justice, say whatever, right? But you don't know if that, in fact, advances a communication structure or a discourse that advantages your preferred policy agenda. So we're really about trying to figure out what moves your policy agenda. And one of the things that moves it is this concept of framing, how the issue is framed. And Neal talked about a bit about in the storylines, but there's a science to framing, and there are metrics to framing. And so back to storytelling, but the story has particular elements that we can measure. Not only can we measure their impact, but we can look at them in a rather complex way. We can look at them individually, values, symbols, metaphors, pictures, numbers, go down the list, tone, and I'm going to come back to this in a minute. But the whole point of a frame is that the frame triggers a shared and durable cultural model. This is why it's not spin, right? Spin's temporary, right? But what frames are really meant to represent are these shared, that is, widely shared across the society, and durable, held over time, stories, if you will, mental models that people use to make sense out of their world. I'll just give you a quick primer from the cognitive sciences. Why do we do that? Because we're cognitive misers. We don't have a lot of gray matter to work with here, folks. Right? Think about what's going on to you today. You're being bombarded by all kinds of information. So what you're looking for are shortcuts to make sense out of it. That's what these frames are. What's this about? Right? And you get it, you instantiate its meaning, and then you get rid of it. Why? Because you have to go on to the next thing. Okay, so that's what these frames are. Okay, I'm going to have a little experiment now. Frames do another thing that's really important. They attribute responsibility. They tell us who's responsible for the problem and who's responsible for fixing the problem. What I worry about with a lot of the individual stuff that comes out of television is that it has an individual level focus. So I'm going to do a little exercise with you. I only have a couple minutes. Now, we know scientifically that you can only reason within the frame. You can only reason with what you've got in front of you. So pay no attention to the blue part of the screen. Okay? Pay no attention to it. You can only reason within the frame. I'm going to give you one piece of communications, and I want you to tell me whose fault it is for the problem and whose fault it is and whose responsibility it is to fix it. Okay? These cows are sick. That's my communication to you. And you can only reason from here down, in the green part. You can only reason in the green part. That's the frame. Cows are sick. Why? Who's responsible for the problem? Bad problem. Cows are sick. They're going to die. Who's responsible for the problem? The cows? Probably not. Who? The farmer. Right? Cows just don't walk around randomly by themselves in wild herds. Right? They're on a farm. Farmer's responsible. Who then is responsible for fixing the problem? The farmer. Cows are sick. Who's responsible for the problem? The factory. Who's responsible for fixing it? Factory, government, somebody's supposed to be regulating them. Just by changing that frame, you assign responsibility fundamentally differently for the problem. So it matters who you're assigning blame to, and public health matters. And too much, the blame is on individuals or individual communities. Or at least we allow that to happen. I want to do something a little complicated. I got 1 minute. So I'm going to use it to do something complicated. This is about criminal justice, but I want to give you this concept of the swamp. And this is something that's very difficult for advocates to understand in particular. People aren't sitting around with nothing in their head waiting for you to drop your pearls of wisdom in their head and tell them what public health issue is important and why they should care about it and fix it. They come with all kinds of junk in their head. They do, right? Stored experiences. So in criminal justice, we call this a swamp. Right? There is a swamp of stuff, and it's swirling around. And some of it may help you, and some of it may hurt you. In criminal justice, up until very, very recently, the dominant thing that came out of the swamp is that criminals are bad people from bad communities with bad parents. Therefore, what do we have to do? Fix the criminals. How do we do that? Lock them up. Right, so the criminal justice reframing had to find a way to get across the swamp. It's the same thing in public health. There's a swamp. I could probably, in a half a day, figure out what your swamp is. And it's all this stuff swirling around. So people aren't waiting for you, right? And they're going to pick what's chronically accessible. Top of mind. That's what they're going to land on. Finally. So people are guessing what the meaning is. They're guessing what your story is. They don't know. And they're picking the one that's most convenient off the top of their head. So how do you get them to change? Not change, I'm sorry. I didn't mean that. How do you make available an alternative way of understanding that sets up your agenda items better and that people believe? And so these are the things you can sort of play around with in your messaging. You can change the tone. We know rhetorical tone's bad. You can't badger people. It can't be argumentative. Have to be reasonable tone. Values matter a lot. People reason from their values. If you believe deeply in Horatio Alger stories, it's hard to believe that systems have an impact. You have to explain things. You guys are in a complicated field. Health and the health sciences of medicine are complicated. You know, so Neil's up here whipping around all these diseases and stuff. I don't know what, I'm like the average person. I don't know what the hell he's talking about, right? So you got to explain it to me. You got to give me a metaphor, right? That allows me to understand it. Big problem for advocates is that they typically don't get solutions up front. And I'll end with this. Order is important. All you have to do is read George Lakoff's book, Don't Think About Elephants, to know that, right? It's not, so for example, it is not necessarily what you say, but it is more the order in which you say it. Neil made a really great comment. Facts in and of themselves don't persuade people. They argue them away, right? And I'll end with my very famous Johnny Cochranism. If the facts don't fit the frame, people reject the facts, not the frame. So you better pay attention to framing. Thank you.
Let's see. There we go. There you go. Yeah. Thank you for that amazing presentation. I think we could have listened to you for another 2 hours. You were just getting warmed up.
I was.
One of the things there's so many things I'd like to ask. I'm just going to ask one question now, and at the end, after we've heard all of our speakers, we'll open it up to the audience. You talked about human understanding being story-based. Why is it that so many researchers, and I will speak for the public health community, believe that if we simply wag our fingers at the public and tell them the facts, that we are expecting them to change? Our experience is it doesn't work. Absolutely. People are not doing what our finger wagging is telling them to do. And so my question to you is, what would you advise the public health community to do?
Very simple, and you describe it very nicely, Sandra. What we know is that there is a difference between expert communication and public communication. Expert communication is what you folks in this room do when you talk at your tables with each other. You have deep knowledge, right? And you have all these arcane acronyms and things for diseases and this. I mean, again, as an interloper, I didn't know what the hell Neil was talking about these diseases and this, that, and the other thing, right? Well, the public is like me. They don't know what you're talking about. So the trick in communications is to figure out how to inject the expert understanding into the public mind. And just simply, two things. One, rhetorical tone never works, right? Because it's confrontational and all it does is make people defensive. It's not reasonable. But more than that, when they don't understand what you're saying, when they don't understand what is at stake, they default, the swamp eats it up, they default to what they think they know. And typically it's wrong, right? Or what somebody else says. So it's if the quote-unquote other side, whatever side you may be on, spends a lot of money trying to invigorate a certain frame. And so I think my advice, and I say this in advocates in lots of different fields, is you need to get out of your own way. You have to understand that the public doesn't talk like you do. And you have to figure out how you talk, what you know, translates. And even on shows like this, it's still pretty technical. And when you're going to, in community in particular, and trying to explain things to people, and others may comment on this, you need a story that's simple, understandable, durable, touches some values they believe in, right? Not that you've got a fact sheet that tells you the advantages of X intervention or Y medicine.
Thank you so much. Let's give him another round of applause. And now I'd like to invite Juan Devis to speak.
Thank you. Thanks for having me here. I feel like, it's interesting. When I started to work in public television, I always saw public television as a public utility. and in a way, it had a responsibility that was different than any other media. And I've been trying to sort of figure out what that role really is. And how many of you watch Masterpiece Theater? How many of you watch KCET? So do you guys think that Masterpiece Theater should be the media that a public utility media company should create? I'm not putting a value judgment on it, I'm just asking. Yeah? I consider it like a high-end soap opera in a way, but maybe some of these health narratives could be part of it. But when we split from PBS, for those of you who may know or not know, KCT split from PBS maybe 4 or 5 years ago. We had a great opportunity, and it was how do we look at KCET as a public utility that goes back to 1967 when the Public Media Act was created to give access, equity, and representation to a lot of different people. And the split really allowed us to look at that in completely different ways. And in the last 5 years since the split, we have been able to look at KCET as an editorial and media place where there's some sort of creative placemaking efforts that we can participate in, right? We can work with experts, we can work with communities to really figure out how to build a sense of place. And since we are here in Southern California and our broadcast range are 11 counties, how do we create a sense of place in these 11 counties? Do you guys know creative placemaking? That term, placemaking? No? So you guys are gonna wonder when I show you the clip that I'm gonna show you, what is the relationship with Zumba, placemaking, health, and public utilities? So one of the things that we've been trying to do in Southern California is really partner with a lot of community organizations, go to a particular area, get their stories, get their data, and try to figure out how to translate it for a public. So we did this long project in El Monte. Anybody has visited El Monte here? Great place with great history and a lot of changes that are occurring right now. But we have spent over 1.5 years working with schools and with community organizations, with youth, to try to find the stories behind El Monte. And in the stories, try to find this place that people can name, that people can be proud of, that people can, sort of come together, in one narrative. And we started to find all these Zumba shops. You guys know what Zumba? Anybody Zumbas here? All right. So we started to find all these Zumba places, and in like little sketchy areas where, there was some sort of weird soliciting going on. These Zumba places started to pop up, and a lot of women would come together, and it starts to sort of reclaim the space. And one by one, in like, the main sort of drags in El Monte and in other neighborhoods here, all these Zumba stores, Zumba shops have started to pop up. And little by little, we realized that these Zumba shops were actually an asset to the community and to the women in these communities. And there were assets not only for, as a place to go and do exercises and feel healthy, but they sort of became community centers, safe places where women in places like El Monte could come and just be themselves and reclaim a sense of self, body, and in a way, a sense of ownership of the neighborhood that they lived in. And it really has brought out a couple of things for us. And it's, there are a lot of health problems that a lot of communities, disadvantaged communities have, but there are also a lot of amazing things that these communities are doing to come together to take a hold of that narrative. And our job has been figuring out as a public media company how do we provide a framework for those stories to exist? So I'm gonna, did you guys get this Zumba little article? I think you should read it. All the Zumba ladies reclaiming bodies and space through serious booty shaking. And this was we had a writer that is working with us in El Monte write this article after we did all these observations. And out of these articles, we created this story. You ready for some?
Ready.
And it's not working. Here, let me see if we can.
Maybe you could just do a Zumba demo for us?
Yeah, we can do. Who are the Zumba dancers here? I'm from Colombia, and from what I know about Zumba, Zumba was created by a Colombian in Miami, and it was a mashup of cumbia and hip hop and reggaeton and all those sort of cool things.
I'll follow you if you lead.
Here we go.
It's been a long week for this mother of three, and now she's getting ready with her friend to go out and do their favorite thing.
Cuando me pongo lista para Zumba, llegan mis hijos de la escuela, entonces les doy de comer, también a mi esposo, entonces les digo, lavo mis trastes, les digo, ya me voy a ir a Zumba, me meto a bañar, me salgo, me arreglo, me pongo mi make-up, mi mousse en mi pelo, y mi perfume, me agarro mi bolsa y vámonos. Pues una ama de casa es difícil, y más cuando tienes 3 hijos, es cocinar, levantarte temprano por tus hijos, llevarlos a la escuela.
Judy and her friend head down Garvey Avenue, a busy street in the city of El Monte. Not an especially welcoming place for women. But that doesn't faze them. They've got somewhere to be. And I'm going to meet them to see what it's all about. The destination is Starlet's Team Fit, one of many small Zumba studios that have popped up in the neighborhood. Offering several classes a day, 5 nights a week, it's an affordable option for women without access to expensive gyms. Walking up, I can hear the music and see women all geared up. Judy's waiting for me outside.
Judy? Oh, yes. Hi, Kara. How are you?
Walking into a Zumba studio is like walking into a party. It's not your typical gym scene, and it's kind of overwhelming.
Porque yo cuando empecé Zumba, lo empecé por estrés, pero también me ayudó a bajar de peso, entonces bajé 25 libras. Y pues tener un buen alimento, y me ha ayudado bastante, emocionalmente y en muchas cosas de mi vida. Mi parte favorita de Zumba es cuando es el calentamiento, cuando calentamos, cuando es más rápido los movimientos, y sí, es lo mejor.
The women seemed so comfortable in their own skin. I couldn't help but join in.
I think it gives an incredible amount of body confidence, self-confidence, a sense of just one's autonomy in the world. I've noticed that at Zumba classes, the age range can be from 15 to 65. So the abuelitas are there, just as the teens are there, just as the, middle-aged working moms are there, and there's sometimes even a child care.
La moda de Zumba es como cada quien lo tome, de cada quien que va a Zumba, pero son los colores, son colores como más fosforescentes, más llamativos, te puedes cambiar como tú quieras y nadie te dice, ay, va mal vestida. No, porque es como tus mayones, tus blusas, pueden ser blusas largas, chiquitas, tus tenis de colores, y es fun, porque cuando te vistes de Zumba es bonito.
Ready, ladies?
Veronica has been an instructor here for more than 4 years.
Zumba is based in Latin rhythms, so that's what they like it, because they already used to the music. They come over here thinking that they're like in a nightclub, so they got fun.
The popularity of Zumba comes from the cultural resonance of it, I think #1, right? So this is music that people will hear on their radios. It also connects to dance traditions in various Latin American communities. And so it's a space where they can come and be part of a different kind of community, be with other Latinas. But I saw a lot of women being driven and dropped off by probably their husbands. So I thought that was interesting, that, you know, okay, now this is your time.
They told me that before the studio was in Garvey, they not even walk in this area because it was bad people around. So now it's safe for them. They stay there for an hour talking and talking and talking. Now it's more people, like people walking, there's more lights, more traffic, more everything. So I guess that's the first way the street changed.
One of the things you hear is people wanting more green space, for example, in various communities. But how about, you know, Zumba space? I don't know, maybe we can't call it green space, but a different kind of claiming of space for health. There's a way in which this space, you know, bringing people here, I think, kind of wakes people up to the possibilities of people in the community, their potential.
Ahora sí, ahora soy mejor persona de Zumba porque empecé a cambiar mucho, sobre todo mi carácter, porque cuando uno tiene hijos tu carácter cambia mucho, entonces empecé y mi carácter empezó a cambiar, fui más sociable, fui una mujer más feliz.
Being a part of tonight's class made me realize Zumba's a catalyst, transforming these women and the neighborhood they call home. I'm Cara Santa Maria for SoCal Connected.
Anyway, hope you like Zumba. So I think I'm done with my time, sort of. But just to little close remarks, I think what Franklin was talking about frame and the conversation about health. One of the things that I think is really important is to figure out what are the stories the authentic stories that the community has, and the authentic ways that they have found to empower themselves to turn their narrative, turn their bodies, turn their space, create a healthier environment. And our role has been to frame those things, you know, and with the help, of course, of the experts like you. Thank you.
Thank you, Juan. So I'm going to ask you one just quick follow-up, and we have to keep moving. But Juan, can you just talk briefly about the online component? Because you've got a real interactive model. So once you get a story that airs on television, how do you connect to the community?
Well, I think it's the other way around. We see TV as an aggregator of a lot of our experiences instead of the other way around. Normally, the online is the aggregator of whatever happens on TV. So, as I said, we have been working, for example, in El Monte for the last year. We have school programs. We're building community gardens. We have we're looking at the impact that some of the community work that we're doing over there is having with the building of community gardens, et cetera, et cetera. But we also have a series of storytelling, historical stories about El Monte, and through spending time in the community, what I called slow media, really taking your time to be there and using the digital space to tell those stories, we're able to sort of find the cherry on the top, which is ultimately this type of broadcast. This becomes a little bit of a culmination, but the real engagement and the real activity happens all online. And yeah, and that's sort of like a little cherry on the top.
Thank you. Let's do it. Okay, David Valdez, I'd love to hear from you.
Time to bring this home. Thank you for having me. And I want to personally thank B. Solis and the California Endowment for inviting me to today's symposium. if you know Dr. Solis, you know that getting a phone call from her is akin to Commissioner Gordon sending up the bat signal.
True.
When she calls, you answer. And so I'm happy to be here, and I owe a lot in my recent career to the California Endowment and all the incredible work that they're doing throughout the state of California. As you heard, I started in 2012 at the YMCA here at East Los Angeles, and part of why I wanted to start talking a little bit about that is just to give you a little bit about myself. I was born and raised in East Los Angeles. I graduated from Garfield High School, and I attended Yale University, and I have a Master's in Fine Arts from the American Conservatory Theater in San Francisco. And today I get to work back in East Los Angeles, which is part of the fabric of what I think is important of what we're doing in these communities. When we're talking to young people about getting involved, especially around health narratives in communities like Boyle Heights, it's really important for us to be able to inspire and demonstrate for them that success comes from all places, including places like home. And so for me, I am somebody that's from East Los Angeles, and I get to work with young people from East LA, and I get to serve as one of the first examples that they see of what one can term success, right? I have a nice education, but I also am focused on trying to improve the next generation of young people that are coming up in Boyle Heights. So what is it that we do? I run a youth institute, which is a digital media program at the YMCA. You heard Juan talk about what he does with KCET. When you think of KCET, or when you think of what Dr. Neal was talking about earlier, you're thinking about media on a large scale. What we're doing at the YMCA is actually creating media at a community level. And we've been able to create and establish a small production studio where we train and inspire young people to be the producers and creators of all sorts of projects. And when you do that, when you get them involved at that level, not only do they begin to understand what's happening in their communities, but they actually begin to become the agents of change for some of those narratives. So for us, the Youth Institute in East LA was brought about through the Building Healthy Communities initiative that the California Endowment spawned a few years ago. And if you're not familiar with BHC, it's a 10-year billion-dollar initiative that's focused in 14 communities across the state of California. And the purpose and the goal is to really begin to shift the health narrative in low-income communities. And it's focused in 14 communities, but really we're looking at the entire state in terms of shifting that narrative. Youth development has been at the forefront and one of the leading ways that we've seen success, because when you get young people involved, especially at the middle school or the high school level, they begin to change the trajectory of their lives, not when they're adults, but when they're actually still developing and taking into account everything that's around them. So for us, it's exciting because we're doing it in ways that's engaging them at their level. So our Youth Institute program teaches them graphic design, teaches them about video production, teaches them about storytelling. And we use these skills to every year produce an annual Youth Institute magazine. We produce short films with them. They work with different community partners, and we've actually partnered with KCET and their Youth Voices curriculum to create content around what's happening in their spaces. And recently, we've also been working with the UCLA Fielding School of Public Health to develop a cookbook. And so for an entire week during the winter break this January, we had 15 students in our brand new demonstration kitchen over at the Wellness Center, which is not that far from here, cooking about 40 healthy recipes throughout the week and doing the photography for all of the dishes that they created, and are now in the design process of putting together an actual cookbook that they're about to publish. And yeah. And we're fortunate to have been working with Dr. Prelip and Dr. Glick from the UCLA Fielding School of Public Health. And I'm hoping that, our design team, we're actually about to move into the copy editing phase that we'll send it to publication within the next few weeks. So once that's out, we'll whet all of your taste buds and lure you to helping supporting our cookbook project. Another big way that we're working on shifting the narrative is actually getting our young people involved in community issues. One of the large community campaigns that we're working on in the Building Healthy Communities across the state is focused on school budgets. And particularly it's focused on the local control funding formula, which was signed into law by Governor Brown a few years ago, and it really kind of changed the way that school budgets were handed out from the state level. So Governor Brown really took the power and the authority away from the state level and handed it down to the local district sites so that they could manage and fund a little bit more of their funding dollars. And the law was intended, or is intended, to really positively impact 3 groups of students. And those students are low-income students, foster youth, or English language learners. And in a community like Boyle Heights, the majority of our students are Latino, and they do come from low-income immigrant families. And so we're dealing with a high density of participants that would ultimately be impacted by this local control funding formula. Problem is, when you're talking about school budgets, it's not that fun. I don't care what form or area you're in. And when you're talking to young people about school budgets, you really have to sort of find a way that's going to engage them around the issues. So we've been working on creating content around the local control funding formula and speaking to young people in a way that was really going to engage them and garner their attention and their participation around this issue. And so with the support of the Alliance for California Traditional Arts, we worked with local community treasures, or what we call cultural treasures in Boyle Heights, some singer-songwriters, to work with some of our state artists, but also community youth leaders, to develop a song from a series, and it was a couple of different collective songwriting workshops, that really speaks about what's happening in the budget. And the big challenge with the budget, especially for an area like Los Angeles, where the district is so large, is transparency around the issue of what actually happens with school dollars. And so for us, getting young people involved in really beginning to question and pick apart what's happening in their schools and in their education is important, not just to raise as a community issue, but also allows them as participants to start to take hold and become those agents of change that we were talking about. So over the last year, we had a couple of different collective songwriting workshops, and we worked with artists, and we also worked with young people here in Boyle Heights to put together a song with Quetzal Flores and Martha Gonzalez from the Grammy Award-winning band Quetzal. And we came up with this beautiful rendition of a song that's called Lights On. In Español, se prende el foco, you turn on the lights to sort of, begin to investigate what's happening. And I had the crazy notion about a year ago to say, hey, let's create a music video. And so we actually worked together and created a community event that was highlighting the issues around the local control funding formula. And then as part of the event, the culmination of this day-long retreat, we filmed and shot this music video that I would like to share with you right now. Now, it's important to note, the song is called Lights On, that almost the entirety of this piece was produced by young people. We had a camera crew of 8 young members from our Youth Institute who shot the majority of the videos, and then they worked with our staff members to make sure that we created all the content and produced it and edited it in a way that's going to be digestible by anybody that sees it. And so in a couple of weeks, the next steps is that we're going to release this as part of a larger campaign that's going to go statewide, and we're hoping to share it out as much as possible. KCT is going to be doing a story for their departures page, but we're also going to be sending out a press release and doing a big sort of music video release online. I want you folks to know that you're the first large assembly that's actually getting to witness and see this music video. So without further ado, I'll put the video on, and if we have a minute after, we'll talk about it. And if you can't read that, it says, in 2014, California artists and students from Boyle Heights participated in collective songwriting workshops to create lyrics centered on education and the local control funding formula. This music video is the final product.
Where does all the money go? To our children? Bureaucracy or to the fat cat? It's a political mirage, an illusion that a gift is being given. Yeah. A sleight of hand, that's a trick. A sleight of hand, that's a trick. Wait a minute, lights on. Recognize you have to deal with us, our presence, our collective dreams for our children. Lights on, lights on, lights on, lights on. We will not surrender physically, mentally, we are present. Answering the call to action in the homes, in our schools, in our communities, in our boardrooms. A sleight of hand, that's a trick. A sleight of hand, that's a trick. Wait a minute, lights on. Recognize you have to deal with us, our presence, our collective dreams for our children. Lights on, lights on. Clarity, don't turn it off. All they want to do is make us go away. Go away, go away, go away, go away. Broken desk and torn down books is what they give us. Dirty crooks, dirty crooks, dirty crooks, dirty crooks, dirty crooks. Let's fix it, schools, and shed some light. It's time for you to do some right. We want and need many things. A sleight of hand, that's a trick. A sleight of hand, that's a trick. Wait a minute, lights on. Recognize you have to deal with us, our presence, our collective dreams for our children. Lights on, lights on, lights on, lights on, lights on, lights on.
Thank you, David. This is really incredible work. I know we're all going to want to ask questions about it, but I think in the interest of time, we're going to move to Q&A to open this up to the audience. And as people think about what they want to ask the panelists, I want to congratulate Sarah Shannon again for her amazing work and this incredible award and this Ruth Roemer Forum. So congratulations. Okay, so I'm not going to ask David a question. I'm going to let the audience ask David questions and all of our panelists. We've got a hard stop for questions at 2:15, so we've got, I guess, maybe 10 minutes. Yes.
Thank you. You mentioned the importance of bringing expert communication into public communication. In order to do that, these experts need to know this public. So how do you think we can generate interest in that understanding? Domestically and globally, we are notorious for not knowing our population and designing programs and policies that don't work, as you know. So how do we generate that interest among this group, policymakers and so on?
Well, really, it's sort of two questions in what you're asking. One I probably can answer, one I'm probably not fit to answer. The one I can't answer, really, is how do you get, how do you ensure, and this is what the endowment's doing with BHC, but how do you ensure there's community voice in the design of policies, programs, and interventions? And I mean, there's a lot of folks in the room who can speak to that much better than I to talk about grassroots organizing and mobilizing. The second is really, and the point I was trying to make, we engage in a process we call map the gap. And so we try to figure out what the gap is between the expert view and the public view. And there's an empirical way you can go about doing that. And then we try to look to see where the gaps are between the experts and the public, and then try to figure out the wrong way. Then design a series of tests to find out what kinds of frames are able to bridge that gap. But the point that I was trying to make is I think it's, and by the way, there's very little private communication these days. People will say, oh, well, this is an internal document with data. We don't, that's one thing I hear. Well, it gets out. The second thing I hear is, well, we're scientists and these are just facts. Well, if you're not framing, somebody else is. And I can take a fact sheet and make it mean about 4 different things. So that's sort of the point I was trying to make, is that if there is a point of view that comes with your agenda, right, and you believe it's based on some scientific understanding, which I hope you would, then the question is, how do you get that understanding into the public mind in such a way that they'll support the agenda that you prefer? So that's, and to me, that's an empirical question.
Thank you. Yes. Here comes that microphone.
Thank you. This was so inspiring and thought-provoking. I would like your advice. I am part of a relatively small group of people that want to start a movement. This is a small group of academicians, professors, physicians, and a few people in public health. And the movement we want to start is one to change medical education and health professions education so that it includes more, much more, about social justice, about the health of populations, not just individual patients, about health equity, about the social determinants of health, things that all the public health people in the room know, but a lot of health professionals in training now don't know, and they need to know to build health equity for the future. What advice do you have for us about how to change this from, small group of dedicated people who have contacts all over the country, but people who are working in isolation? How do you create the movement? I hear that we need a frame, which I don't think we have, but what can you tell me in short time about what we should be doing?
Franklin?
I'll take the first stab at it. To me, it begins with community partnerships. You look at the organizations that are already doing some of the work in some of the areas, the social justice areas that you would like to highlight in shifting, the education, and you work on shared projects and partnerships that will allow you to sort of educate in both directions, right? So the experts that you're working with, all the academics and the professors, will learn from the community-based organizations that are doing the work in the communities, and vice versa, and then you can create products. Our cookbook and our music video came about through community partnerships, and it came about from brainstorming ideas together. And so I would recommend that would be the first place.
I think that one of the things that we've learned when we split from PBS and we lost our arms and legs and fingers and everything was that the only way to survive was to open source our institution, our organization. And that literally meant we cannot do it alone. And the only way that we will survive, and I actually think that this is for a lot of things in currently, is through partnerships and collaborations and understanding that that other people have competencies that you don't have, and not only intellectual competencies, but managerial competencies and technological competencies that need to be shared. And if you figure out a framework for those things to come together, it will be a beautiful thing. And I think that a lot of people are asking that question and trying to figure out what that framework is.
I'd like to jump in too. I have worked on changing medical education in developing countries. I did it for 20 years. And out of Johns Hopkins University, we would do, this was in Latin America, and so we went country by country, and much like our panelists said, we formed partnerships. We would identify the decision makers and stakeholders in medicine, nursing, midwifery, the government, the private sector, and we would create a working group and bring in the edgiest, most interesting speakers that they really wanted to hear from and to be part of the conversation. And so it was part seminar, part workshop. So we'd start with some kind of updates, you know, the latest and greatest, the most advanced, the cool stuff, you know, the edgy stuff. And then we'd have a conversation, and we actually mapped out what we called guidelines for education. And it was a very collective effort. But the key in our process was, rather than have the same people rehashing the same old myths and content and everything that had always been done, we had to sort of elevate the conversation and, you know, bring in some new voices and some new, and we also had, you know, students and ultimate end users of the service delivery, in other words, the medicine that would be delivered. So we had a really sort of diverse group. And we called it a sub-P level, rather than trying to change policy from the very top. We did the sort of sub-policy level, which were more kind of working guidelines. And then we would work to get them institutionalized in medical schools or through medical school networks. Hope that helps. Yeah. Yes.
So maybe this is maybe directed to maybe one, but maybe all of you can answer this. Because I know, David, you mentioned really engaging like youth, or maybe actually just in general communities that have been, in which some of these institutions like the education is disconnected from. What did you find most efficient in terms with, like, you know, practices with really engaging and collaborating with these communities to really be empowered to working with these issues and tackling it themselves and really you know, addressing those issues, especially since you know, LUSD is really trying to manage more of the budget that they have now?
That's an easy one. I'm going to answer it very short. You teach young people how to lead, and then you let them lead. Plain and simple.
So do we have time for one more question? Okay. I think there was one over here.
I'm very inspired by what all of you have displayed here. For the Zumba and the LAUSD projects, I mean, those projects seem very powerful, but I think when I listen to it compared to what Dr. Gilliam was speaking of, it sounds like you're targeting somewhat of a small sort of, maybe a smaller community, and you're having some good impact in that community. But I'm trying to think of like campaigns or things that can be done that can push the envelope sort of like across a national perspective. So I think when Dr. Gilliam was speaking, he didn't say, but I imagine that he was talking about some of the competing messages that people were getting in communities, like from corporate communities that have the money to obviously, you know, promote something other than the public health message that we're trying to communicate to our communities. So, you know, is a national campaign, you know, where public health is funneling money or pushing money towards a broader campaign. So when I think of, like, you know, how we all wear seatbelts now, smoking is a little bit frowned upon, you know, there's some national campaigns that really have had some impact, you know, in the last 25 years. But I think around some, you know, other issues, you know, they're very isolated, small impact, which is great. But I don't know if money targeted to just smaller projects is, you know, can be as impactful for the nation, you know, as, you know, getting the federal government involved, state governments, you know, down to, you know, academia, social institutions, public schools, and, you know, even if it's a music video that goes viral across the country, I mean, it'd have to be something to me that's a lot broader. So I'm just curious as to how do you bridge between, you know, framing something, you know, for the larger public versus framing something for smaller communities that are having great impact but may not be felt in Texas, you know, or anywhere else in the country.
It's a great question. I just want to jump in there and say that designated drivers and seatbelts that widespread use of them is attributed to TV shows. Just thought I'd toss that in there. Do you want to respond, or?
Well, the only thing I would say is that we need to do all of these things.
That's right.
And there are different folks sort of working on different parts of the elephant, so to speak. The thing that I worry about, and I actually found this when we first started, we started doing with the endowment years ago, the endowment and wellness around health insurance, was what I worry about is the inconsistency of the messaging across levels. That is, from the community level to something broader. The core values propositions have to be similar. And I say this to you, you're right at what I was implying, that there are forces that spend lots of money being consistent from the national level to the local chamber of commerce or YMCA. They have playbooks, they have prepared speeches, they have what you say to the Chamber of Commerce, what you say to and the message is the same. I fear that those of us who are interested in questions of equity and justice worry more about being righteous than we do about winning. And by winning, I mean making positive change in the communities we care about. So that's always been my critique. I always get yelled at by my friends on the progressive left because I always criticize them for for being too damn self-righteous, and instead get intentional and disciplined, because that's the battle you're in. And so for the people, many of us in the room, you're working in community, right? You can't fight Wall Street, right? I mean, it's hard. And they're pushing that message down to your kids. And so we've got a, sort of, it's an all hands on deck kind of work. But for me, I think you have to find the core, you have to define a core message, and then you think about it as an operating system with apps that you do at the Y, that you do at public television, that you do in the State House. That's my own view.
And with that, I'd like to thank all of you and close this wonderful panel.